appreciation of our target audience, including their communication needs and preferences. We had to invest in research that assists us to package our content for the different segments of our population. Our research also assisted us to obtain feedback on the impact of our messaging and also assisted us to identify the glaring gaps in how we interact with our communities. Our communication intervention was in 4 fronts. We had to depend a lot on the media, which I think one has to emphasize that media in this country went beyond the call in making sure that the information educating of South African is achieved. We also invested in a paid-for advertisement, which was both in the broadcasting print media. We also invested in the face-to-face engagements, and also we invested in the digital media platforms. To date, the last research report that we received was that over 90% of South Africans know and understand the basic health protocols that needs to be adhered to. However, we are also very much aware what research tells us that we still have some challenges in how the South Africans behave in terms of observing the health protocol as provided. We have also amplified our interventions by building considerable number of partnerships with the private sector, with community-based organizations and the faith-based organizations. We have provided them with the information packages which they've used in their various platforms. We have also invested in working with the community-based media to reach the communities across the country. In the midst of our successes that we have achieved so far, I would also like to mention some of the curveballs that we have had to contend with during this period. When President Cyril Ramaphosa announced the national state of disaster in March 2020, our economy was on a slow growth trajectory. The Statistician General had reported that the South African economy recorded its 3rd consecutive quarter of economic decline, falling by 2% in the first quarter of 2020. This followed a contraction of -1.4 and 0.8 in the 4th quarter of 2019, respectively. Unemployment increased from 29.1% to 30.1%, and we should indicate that the majority of the people who are unemployed at the moment are young people. The long lockdown restrictions further worsened the economic hardships faced by a number of South Africans. To mitigate the impact of the COVID-19 on the economy, the government announced a 500 billion package, a social relief package and economic support to the struggling businesses and also to the poor people. Apart from the economic decline, we have also noted a lot of hardships from families who lost their jobs and also some of them who have sadly lost their loved ones during this period as a result of the COVID-19. Unfortunately, the good work done by government was to a certain extent spoiled by reports of acts of corruption involving unscrupulous companies and individuals. We remain encouraged by the freedom of the press in our country, which has contributed greatly in exposing some of these acts of corruption. Government respects and acknowledges the role the media that plays in safeguarding our democracy. We are also encouraged by the swift intervention by the law enforcement agencies to deal decisively with corruption. Chairperson, as I conclude, it is my view that our government responded swiftly to deal accordingly with COVID-19 by imposing the national lockdown. I strongly believe that this intervention assisted in strengthening our state of readiness as we subsequently started experiencing a decrease in the rate of infections. This has resulted recently in further reopening of the economy to level 2 of the risk-adjusted strategy. Level 2 further reopens our economy and relaxes restrictions on the movement of people, particularly interprovincial traveling. Once again, government played a central role in informing the public about the revised regulations through different platforms and in all the official languages. Lastly, when the president was addressing in the last address to the nation, he reminded us by using the quote from the former president Nelson Mandela that as we move to level 2, everything will depend in our hands and us taking responsibility as the citizens, as we know that COVID-19 is not yet gone. We've just reduced the number of infections, but it is still with us. I thank you. Bye, Danki. Asante san.
Thank you so much, Director General Pumla Williams, for setting the tone for us. It really has been a difficult time of loss, but also a time of learning for people in the communication space. And learning is what we will get from our next speaker. But before I go to her, I just want to re-emphasize again who our speakers for the day will be. We have Ms. Eba Kalondo. She's the AU spokesperson in the Commissioner Musa Faki's office. That's as senior as you can get in the AU office. And we have Ms. Guguntuli, who's the Group Executive for Corporate Affairs at SABC. She'll be talking about leading communications during a pandemic. We also have Ms. Fatima Wane, a journalist based in France, a similar organization that Ms. Kalondo used to work for, France 24 International News. And we also have Dr. Oscar van Heerden, a scholar in international relations, with his focus on international political economy today. And we'll also have a closing of remarks by Tasneem Karim, a long-standing civil servant. Let's welcome now Ms. Eba Kalondo. Ms. Eba Kalondo is a spokesperson, as I said, in the chairperson's office in the African Union Commission. Prior to that, she held several senior positions in strategic and risk communications at the World Health Organization Foundation, Hirondelle, and France 24, and Reuters. Ms. Kalondo, the floor is yours.
Thank you very much. Thanks very much for having me. And it was lovely to hear from the Director General Williams in terms of the response capacity from South Africa in terms of the communications work stream in terms of the response in South Africa. And that probably does then set the tone in terms of what you call learning. You know, I think and it strikes me quite significantly that for the most part, many countries are learning about pandemics in South Africa and around the world now. And yet Africa has had extremely meaningful lessons to learn, which we gleaned from the 2014-2015 West African Ebola pandemic. And that was the first time when a public health emergency of international concern, like the current COVID-19 pandemic, is now really struck Africa, but as a global pandemic with SARS and MERS before it. The epicenter was in West Africa for the first time, and also for the first time outside of rural and really remote areas of the world into urban centers and hubs, which then spread the virus even further. And then we saw in 2014-15 exactly the difference of what a pandemic is as opposed to an epidemic, for example. And especially a pandemic with great potential for spread internationally and nationally, and one that can completely dislocate and dismantle socioeconomic gains, and in turn introduce a new spectre of political instability, like we did see in West Africa at the time. So what the African Union was able to do from lessons learned from that, and I'm really going to try and condense this as much as I can, is that the heads of states of the African Union at the time decided, actually, we can't do this again. We cannot do this again and not be as unprepared as we were, fully cognizant of the level of health systems on the continent. And it was really because of the lessons learned in 2014 and 15 that Africa CDC was then created. It was a decision of heads of states to set up a technical agency of the African Union to deal with public health emergencies and public health threats. Also, it was also at the time that heads of states of the African continent were able to see that there are international instruments that all African member states, in fact, the entire globe, encompassing all of the global membership of the World Health Organization, we are all signed on to something called the International Health Regulations, which is the only international law that governs public health and public health emergencies, putting it within the sphere of global health security concerns. And when you do come to a public health emergency of international concern like we are seeing now with COVID. All of this we've seen with Ebola 2014 and 15. And one of the biggest lessons was that, and this is part of how the continental response today, which is being coordinated by the Africa CDC, has incorporated those lessons of the need to collaborate, to communicate, and more importantly, possibly to coordinate, to collaborate, communication, and collaboration. And that began on the 20th of February this year, after Africa registered its first COVID-19 case in Egypt on Valentine's Day, on the 14th of February. Almost a week later, the entire membership of African health ministers held an emergency meeting in Addis Ababa to come up with a continental plan for that collaboration, coordination, and communication. And it is that continental strategy that has been in place since the 22nd of February that is being fanned out across the continent and domesticated throughout the AU membership. And that is really where the African Union is leading. When we talk about communication, this has always been a learning curve, because one thing that we see from one pandemic to the next, and what people forget, is that Africa is probably host to the biggest number of public health threats on the planet. We've had pandemics before. In fact, when COVID-19 came to pass, we were already dealing, and I'm sure Jessica Ilunga will tell you about this, we were dealing with an Ebola pandemic, which was also a PHIC, for almost 2 years. So that's why Africa was better prepared, because we have experience of pandemics. And DRC, and I'm sure Jessica Ilunga will talk about this, is paradoxically one of the most prepared countries to deal with a public health emergency of international concern, for the sole paradoxical reason that it has had so many before to deal with. And we're not talking, whether we're talking about cholera, whether we're talking about Zika, whether we're talking about Ebola, and whether we're talking about yellow fever. So the experience in dealing with public health emergencies of international concern has really been well covered on the continent. And if you do see places like Liberia or Sierra Leone, where I was serving for the United Nations during 2014 and 15, is that one thing that was very clear is that communication during a pandemic is not communication during peacetime, because people don't listen in the same way, nor impart and receive information in the same way when they are panicked and anxious and are not sure of what tomorrow will bring, and the lack of autonomy that brings with it. And so communications really is the foundation of how governments run their national responses. And we've seen this, that all AU members now have what we call our emergency operation centers, where there's sort of an integrated incident management system, of which risk communications is a really integral part. Because what it does, it is the transversal link to all of the areas of work needed to be able to mount a response. And basically what risk communications does is not just to communicate. I think a great part of communication during a pandemic, when people are feeling out of control and they're therefore angry and distrustful, is credible communication from one source that remains consistent. And a great part of that communication, what we've learned in from 2014 and 15, is actually not communicating at all, but listening, real active listening to understand how people perceive what it is that they are living. Whatever communications messages you give out, unless they are understood as they are intended, they mean nothing. So listening has been a very integral part of communication in pandemics, because you are dealing with uncertainty, with distrustfulness, where the public trust in governments may or may not be at optimum levels. And also what pandemics do is that they bring into focus existing fault lines of inequality, because the pathway of pandemics is inherently political. It comes from the most neglected areas and then it moves forward. And I think what governments are starting to realize now, that if community-led and community-owned instances of communication and engagement, I like the word engagement rather than communication, because it has to be two-way, is extremely crucial to be able to paper over those existing inequalities that just become glaring in the full glare of light. And also, it also weakens the political and social contract of that society, meaning that pandemic responses, whether they be public health or community-led or economic, have to be all of society types of responses, which can only be led and be successful if they are owned, to be trusted by the community. It cannot be the politics leading, it has to be the science, but it can only be the science if that science can then be translated into something that is understandable, that can also be interrogated by the stakeholders in ways that they are most comfortable with. And this is what governments and societies are learning today, and I'm sure we'll hear about it during the course of this afternoon, how the media is as challenged as the rest of society, whether it be the government that is leading the national response, whether it is the community that is bearing the brunt and trying to protect themselves in ways that make sense to their belief systems. And the media as an integral part of communicating not only the risk, but also the protection measures that you can be to be able to protect yourself, your community, and your country, is that the only one thread that links all of us together is trust. That's the only currency. And it's to build it, to establish it, to maintain it, and know that when it takes a hit, to acknowledge what you've done wrong, what it is that you're going to do to make it better, and do it. So I'm really interested in the conversations that might follow today, because at a continental level, what we are seeing is this new expression of the current status of the social contract in all its diversity, and how the legitimacy of our leadership, whether it be political or otherwise, or even in the communication space, is how to be a credible voice by being truthful. It's not about what we know. And I think part of the communications in pandemics is rather talking about what we don't know, because what we're doing is dealing with uncertainty. Let me stop there and listen to the rest of the...
Well, we could listen to you forever, really, but thank you so much for such a thoughtful presentation, Ms. Kalondo. And I just want to ask you, leader after leader has come up to say that because this pandemic was jumped on the world, there was no way anybody could have prepared for it. What sort of tips would you have for communicators in situations? I know you say that Africa is one of the most prepared continents because we are more at risk than other continents. But how can communicators prepare for scenarios that are jumped on them and they're not fully prepared, but have to send out messaging in relation to those situations?
You know, I think humility, because the thing is, nobody expects you to know. when these things are such sudden occurrences, and nobody expects you to be an epidemiologist when what you are is a communicator. I think part of I don't want to say the beauty, but one of the levelers of public health emergencies is that, you know, everybody is challenged by it, whether from our belief systems and also from our skill set. I don't expect a journalist to be able to talk like an epidemiologist. What I would expect is that, you know, you ask and say, look, there's this thing called COVID. What is it? And what is it not? And what does it mean? And what does a pandemic mean? I think really this is where the beauty of communication happens, is it goes right to its basics. You ask, what is it? I don't know what it is, so find somebody who does. And then you are able to, as a communicator, then translate all of that gobbledygook, jargony, technical advice into something that not only makes sense, but more importantly, during a pandemic, people need to be reassured, but not overly reassured, because you cannot overpromise in a fast-changing environment where even the facts change, because we're all going through it for the first time. So it's a thin balance, isn't it?
Absolutely. But thank you once again. And as we try to digest all of the wonderful things that you've just said, let's just remind all of the participants today that we're running a poll. The questions will keep coming up on the screen and you can engage with them and answer some of those. And we'll be looking at the results at some point in the conversation. For now, let's play a short video, and thereafter we'll be introducing our next speaker.
So the GCIS webinar with media practitioners from across the continent, about to have a presentation there. We were listening to Eba Kalondo. She is from the African Union and saying that during a pandemic, politics should not lead, science should, emphasizing the importance of trust and credibility when it comes to both the government and the media and how people take news out. Perhaps we can go back to that presentation.
Face mask, no entry. You should always wear a face mask when you come into a public building like this one to help contain the spread of COVID-19. Don't stand too close to other people. Please stand at least 1.5 meters away from other people. Follow the floor markers for physical distancing. Go through temperature screening. As a precautionary measure, all staff and visitors are required to go through temperature screening. Remove your gloves upon entering. You should follow strict hand washing and sanitization procedures. Use hand sanitizer. You can use your own sanitizer or wet wipes in the presence of security personnel only if there is proof that these have at least 70% alcohol concentration. Only 3 people are allowed inside the lifts. Staff or visitors who are fit and younger are encouraged to use the stairs. Wash your hands with soap for 20 seconds. You should always use soap and water to wash your hands after using the bathroom. Scrub your hands for at least 20 seconds. Let's continue to stay safe and stay at home. Together, we can beat this.
Thank you so much, everyone, for staying with us through that little direction in terms of directives, in terms of how to handle our lives. It's called the new normal. Our next speaker, Ms. Kalondo, while speaking, referred to her quite a bit, which gives one the sense that they probably know one another. Jessica has got such a a diverse CV, senior positions in communications, but she's also a master's graduate from the University of Cape Town. But what she really is focusing on today is how she led communication during the Democratic Republic of Congo's most dangerous Ebola outbreak. Ms. Ilunga, thank you so much for making the time. You may begin your presentation.
Thank you, Desiree. And hi, everyone.
Hello.
Yes, I prepared a short presentation. I don't know who's going to share the screen. Should I share it or the organizer will do it?
You can share it on your side, Jessica. Thank you.
Okay, I'm going to do it. There it is. Is that okay?
That's perfect.
Perfect.
Okay. Great. So, yes, I was asked to talk about my experience leading communication of the Ministry of Health in DRC during one of the largest Ebola outbreak in the country's history. And so here is what I'm going to talk about. Just to give you a little bit of background, so DRC has a long history with Ebola. So the virus was discovered in the country in 1976. Since then, we've had 11 Ebola outbreaks. So I was working on the 9th and the 10th Ebola outbreak between 2018 and 2019. And just this year, when the 10th Ebola outbreak ended in June 2020, well, you had another one coming back in the Equator province in July 2020. So now they are dealing with a new Ebola outbreak. And so, it was interesting. The talk of Eba was really nice because she mentioned how communication during crisis, like during a pandemic, is not the same as communication during peacetime. And so in any case, any crisis will bring its loads of challenges. But then for the 10th Ebola outbreak, we had even more challenges and complexity on top of that. So first of all, the outbreak occurred in the provinces of North Kivu and Ituri, which have been affected by violence for more than 2 decades. And so you have hundreds of armed groups which are active, and actually like insecurity was a major issue during the outbreak. And every week you would hear about people being killed by armed groups in the areas where we were operating. So it was a major challenge. Then you also have the fact that North Kivu was also one of the most densely populated provinces in DRC. And as Ebola spreads by close contact, obviously it was way more difficult to kind of control the outbreak in cities where you have million inhabitants living closely together compared to when you have to deal with the same outbreak in a village where you might have maybe 50 people living there with almost no relation or contacts with the rest of the city, I would say. Then we also had like a high population mobility because population North Kivu are known for being traders, so they travel a lot within the region and also also sometimes outside the region and outside the country. So for instance, the cities where you had the Ebola outbreak, people have close trade connection with Rwanda or Uganda, Burundi. So it was also a major challenge to kind of keep the virus within the country. And then the timing of the outbreak was also quite crazy because it started, or the outbreak at least, was officially detected just 4 months before the long-awaited presidential elections that had been delayed for 2 years. So political tensions were extremely high people were suspicious. And so in terms of building trust, which is essential in an outbreak, it was like almost impossible. I think nobody even believed that we would be able to really convince people that the outbreak was real and that they would accept that, no, it wasn't just a plot by the government to further delay the elections, or because that's exactly the type of things we heard from the population. And so here is just some kind of a summary of the outbreak, some key numbers. So it lasted for 23 months. You see that in terms of casualty, it was quite high. So we had never had an Ebola outbreak that made so many victims. And you see, and also a peculiarity of this outbreak was that a lot of children were also contaminated. And we actually did a few research to try to understand how come so many children between 0 and 5 years old were more at risk than previous outbreaks. So I think they are still trying to figure this out. I haven't seen any kind of a conclusion yet. And then you can see in terms of the footprint, so it affected like 3 provinces of the country. And like some of the big successes were in terms of vaccination, where we had almost 304,000 people who were vaccinated, and travelers, we had like almost 182 million travelers who were screened within the countries because we had health checkpoints across the country, across the province, and at the borders to take temperature and also to ask people to wash their hands to help stop the spread of the virus. So in terms of communication strategy, it was quite interesting because when I started, I realized that despite a long history with Ebola, the Ministry of Health had basically no clear template or no kind of basic for a communication strategy. So I pretty much had to start from scratch. But what was good is that just maybe, I think it was in 2018, before the 9th outbreak started, I had the chance to attend a training by WHO called the ECN training, the Emergency Communication Network training, which actually gave me kind of the basics that I needed to then, I would say, face the outbreak with more confidence and not, knowing a little bit what I was doing. Because before working at the Ministry of Health, it's true that I had no specific expertise in health communication. I had worked in a communication agency in London. And so I was working on so many different, I would say, sectors, but not necessarily health. So having this training actually helped me to start building something that, help us deal with that. So in terms of my communication strategy, the first part was the vision. And I think what was really important for me was that the Ministry of Health had to be a trusted and credible source of information on the outbreak within the country, but also internationally. And that's something that is not necessarily easy, especially considering the period, because the period, like I said, the political tensions were quite high. And so I would say that the Congolese government was not the most trusted voice out there. And so for me, it was really important to build that reputation and make sure that people trust what we were, the information we were sending out. And also the second objective for me was to make sure that by communicating in a timely and also transparent manner, we would be able to...
So we come out of that GCIS seminar with Jessica Ilunga speaking. She used to be the former communications director at the Department of Health in the Democratic Republic of Congo, speaking about the importance of trust when it comes to a pandemic, referencing her experience working with Ebola outbreaks in the DRC, and also speaking about how there needs to be trust from the people who are communicating communicating, especially the Department of Health, as she referenced, when it comes to a pandemic, so people trust the information and are able to process and use it properly. And it seems that's where we leave it for On Point this afternoon. The SA Today team are standing by to bring you more news at the top of the hour. It's good afternoon.